Do you know anything
Right.
about how it's viewed differently in different cultures?
Well, I actually think that in different cultures there's more of an acceptance of the life transitions and stages. In some of the traditional cultures, it's actually revered. A woman going through menopause is considered to be the most wise like in the Native American tribes. So the chiefs would even consult all of the perimenopause and menopausal women for their increased wisdom and intuition.
Yeah, and it is interesting that when culture defines a period in life in a certain way, that people react to it in the way the culture defines it. And,
Right.
and menopause in our culture is often defined as a medical problem.
Right.
How do you treat, if women come to you with symptoms, we should talk about some of the other symptoms aside from just feeling hot flashes and sweating and redness. How do you, let's talk about the other symptoms first, and let's talk about how you treat them. What other symptoms are there in addition to feeling periodic times when you feel incredibly warm? What other kind of symptoms are there?
There are also some mood swings. People do talk about this is a time when they might have more anxiety than they really have had it before in their life. Also, they may have decreased sleeping. They wake up more in the night, have more disturbed sleep. Weight gain is another one.
And irregular menses, too. I would imagine women, and you mentioned that before, either women have very, very light periods or very, very heavy periods.
Right.
And probably very irregular, too, that especially women who are used to having 28-day cycles,
Right.
30-day cycles, suddenly find themselves skipping months when they're not bleeding at all,
Right.
other months where they bleed very heavily.
True.
So let's talk about how you treat, and I imagine there are different treatments for each one of these symptoms, or not. Why don't you tell us about what kind of treatments that can be used?
I like to talk about treatment in context of it's important to see your physician and kind of go through this. And in your particular situation, it might be that your doctor would want to rule out a problem with thyroid. They might want to make sure your cholesterol is okay. You know, so some various things that are important at this time of life and that can change at this time of life. A larger percentage of women in menopause have thyroid problems. And so it's important to know what we're dealing with. Are we dealing with just perimenopause symptoms? And if so, if we've ruled out other problems, then we talk about specifically what's going on in their diet, their exercise, are they taking vitamins? So cover the basics of health. And then if there is a real severe pattern of hot flashes, let's say they're not sleeping well at all, that affects your quality of life tremendously. And so the severity of hot flashes will cause us to think about strategies for dealing with that. And there are a number of steps you can take to deal with hot flashes. Avoiding caffeine, avoiding alcohol before bed, trying to help control the stress in your life. Getting exercise helps. Certain foods that have healthy fats, such as the omega-3 fats and the essential fatty acids.
And omega-3 fats come from fish.
Fish, the highest, richest source is flax, and I invite everyone to check out flax. It's a wonderful food, and
It's a grain.
It's a grain. It comes in cereals. You can find them in Kroger's. That's a very good way to get flax. You can also add ground flaxseed to basically any recipe. Can take some ground flaxseed, just 1/4 of a cup. It's got good fiber, has all those omega-3 fatty acids. It helps with keeping down what we call abnormal oxidation in your body, and so it decreases inflammation, can even help you lose weight. So, and that's a whole mechanism. It's a long story, but I would just say it's a great food for menopause.
Let's talk about hormone therapy, because I think that's what people think of first. When they think about treatment for menopausal symptoms, they think about hormones.
Right.
And that's become incredibly controversial lately. There have been some studies that have been quite alarming and very well publicized. Tell us a little bit about that history and how menopausal symptoms have been treated hormonally.
Okay. Yes, we have had a big shift lately in the medical community on hormone replacement therapy, and we are no longer routinely prescribing it.
It was almost automatic. I mean,
Yes.
there was a whole generation of women where you came in, you said you were menopausal or perimenopausal, and hormone replacement therapy was an automatic prescription.
Right.
But that is not the case anymore.
Right, it's not the case anymore. We do, however, use hormones, and we use them cautiously, just like we use any other medicine. But if we need to, we do prescribe them. And I have some women who are on hormone replacement therapy. And it's a joint decision between you and your physician, and it's based on many factors, even family history, things like breast cancer need to be considered.
Explain exactly what you mean by hormone replacement therapy. What is it that you give women, and how do you decide what hormones that you're going to give them?
Okay. In the perimenopause time period, we may just give progesterone. If it seems that what they're experiencing, they're still having periods, but they're irregular and they're having some of the symptoms, we may try a progesterone cream.
Okay, let's review again what progesterone does. Progesterone is, when you're menstruating normally, progesterone rises right after your ovulation. That's the signal that you've ovulated. It rises quite precipitously. So why would you give women who are having menopausal symptoms progesterone? What effect does it have?
Well, it does seem that the estrogen is produced regardless of whether the progesterone is produced. So now you've got this imbalance.
And that's what you meant when you talked about unopposed estrogen. So you still have estrogen being produced, but no progesterone.
Right.
And it's the unopposed estrogen that's causing women to feel incredibly warm. That's part of the hot flashes. Does that also cause the very heavy bleeding, possibly, or the very light bleeding? It causes the irregular, unpredictable kind of bleeding.
Yeah, and if you have a spike of estrogen that progesterone does not balance, then the lining of the uterus can get built up much more heavily. And then you have this heavy period.
That's why, a very, very heavy period.
Right.
So when you talk about hormone replacement therapy, you mentioned, okay, you're talking about giving women progesterone. Is there any other hormone that you would give women?
Yes, and once women start into full menopause, where the estrogen is low, the progesterone is low, the FSH and LH are high, we can do a blood test and we'll see that the FSH is at that high menopausal level. Then we can consider estrogen and progesterone together. And what I tend to use is the bioidentical hormone. Bioidentical means hormones that are made to be exactly the same as the hormones that are in our body. Now, there are a lot of synthetic estrogens and progesterones out there, and pharmaceutical companies market them, and they're in birth control pills, they're in some of the menopausal preparations as well. But the bioidentical hormones are compounded and put in capsules, and you take them once or twice a day, depending on your doctor's prescription. They are compounded to have generally 3 different types of estrogen. And estriol, estrone, and estradiol are the 3 types of estrogen that are in the capsule.